Cardiac glycosides are naturally occurred substances used to treat congestive heart failure and certain arrhythmias. Cardiac glycosides are inhibitors of the sodium-potassium pump, also known as sodium-potassium ATPase, NKA. NKA uses ATP energy to actively transport sodium and potassium against their concentration gradients across the cell membrane. 2 potassium ions in and 3 sodium ions out with each ATP molecule consumed. NKA action maintains a resting membrane potential that is crucial for cellular excitability, underlying nerve transmission, and muscle contraction. The sodium concentration gradient created by NKA serves as the driving force for another ion transporter, the sodium-calcium exchanger, which uses energy from the downhill movement of sodium into the cell to pump calcium out of the cell against its concentration gradient. Inhibition of the NKA by cardiac glycosides leads to an increase in intracellular sodium concentration, lowering the magnitude of sodium gradient across the cell membrane. This impedes the activity of the sodium-calcium exchanger, causing intracellular calcium to rise. Because calcium is required to maintain cross-bridge cycling underlying muscle contraction, higher calcium levels lead to increased contractility of cardiac muscle. This positive inotropic effect produces a higher cardiac output, relieving heart failure symptoms. Cardiac glycosides also stimulate parasympathetic activity via the vagus nerve, thereby reducing heart rate and slowing conduction through the AV node. This reduces workload on the failing heart and helps prevent certain arrhythmias. The most commonly prescribed cardiac glycoside is digoxin. Once a first-line treatment option, the use of digoxin is now limited to patients who do not respond to newer drugs with better safety profiles. Digoxin has a long half-life and requires several days of meticulous dosing to achieve the desired plasma concentration. The therapeutic safety window for digoxin is very narrow. Even a small increase in plasma level can lead to toxicity, which most often manifests as arrhythmias and can be life-threatening. Other common adverse effects include fatigue, muscle weakness, blurry vision, sleepiness, delirium, and gastrointestinal problems. Digoxin may also disturb electrolyte balances. Several factors can increase the risk of digoxin toxicity. Impaired renal function, low body muscle mass, and some digestive disorders can increase plasma concentration of digoxin. Certain metabolic and electrolyte imbalances, especially hypokalemia, can enhance digoxin's toxic effects. Finally, many commonly used drugs are known to interact with digoxin.